symptoms you should never ignore. No one knows our bodies better than ourselves, so when something is wrong, it does not take long to notice. Paying attention to new sensations or pains that can be one of the most important tools in detecting and preventing many fatal conditions. Minor aches and pains we can solve ourselves, but certain symptoms we should seek medical attention right away. Neurosurgeon Dr. Keith L. Black says, "The things that we doctors are most concerned about are new symptoms that develop quickly, rather than things that develop over a long period of time." How do we know which symptoms to be concerned about? Chest pain is very serious and requires immediate medical attention. Pain or lingering tightness in the chest can be an indicator of a heart attack, or even a blood clot. Dr. Shilpi Agarwal writes, "Any chest pain, especially accompanied by sweating, pressure, shortness of breath, or nausea, should be evaluated by a medical professional right away." Chest pain does not always mean that something terrible has happened. But it is always better to be safe than sorry. Sudden severe headache, particularly if it feels worse than any headaches you have had before, is a strong indicator that you should see a doctor right away. These terrible headaches could be a sign of an aneurysm or even a burst blood vessel in the brain. The other possibilities are meningitis or shingles. The Cleveland Clinic writes, "A sudden, severe headache could be a sign of a more serious, life-threatening condition. Up to 6% of the population could be living with an unruptured brain aneurysm." As with the onset of any sudden symptom, seeking medical attention is always the smart move with a terrible, unexpected headache. Sudden confusion or an inability to concentrate are extremely serious indicators that something is very wrong. Medical attention is definitely indicated for confusion or a major change in personality. The strange behavior could be an indicator of a brain tumor, bleeding in the brain, or even a stroke. It could also be a sign of low blood sugar, dehydration, or an infection. Dr. David Bronson writes, "The mortality rate for severe confusion is pretty high. You have to figure out what's going on. If you see a change in behavior in you or someone else, it is definitely best to seek medical help as soon as possible." Unexplained sudden weight loss of 5% of the body or more over a relatively short period of time is a serious indicator to see a doctor. One of the biggest symptoms of several types of cancer is this type of weight loss, and it is important to sort it out as quickly as possible. Other possibilities are diabetes, depression, and problems with endocrine system. Dr. Julian Sink writes, "Colon cancer is commonly associated with unexplained weight loss. Shedding a few pounds is not cause for concern. If you find yourself unsure of why you are losing weight, it is best to get things checked out. Seeing flashes of light, or unexplained bright spots, in front of eyes is certainly a reason to see a doctor. These flashes or the presence of a large amount of floaters in the vision could be a sign of a detached retina, which can quickly lead to permanent loss of vision." The National Cancer Institute writes that although these symptoms do not cause pain and may seem harmless, getting fast treatment can save your vision. A flash of light may mean nothing. It is definitely better to be safe than sorry when dealing with your long-term vision. A persistent fever certainly requires medical attention. A fever indicates that your body is battling some kind of infection. A more serious fever indicates a more serious infection. Possibilities include meningitis, a urinary tract infection, or even some forms of cancer like lymphoma or leukemia. Dr. David Bronson writes, "Fever of 103 degrees and higher warrants a trip to the doctor. If at all the likelihood of cancer being the problem is low, most of the causes require antibiotics, making a doctor's visit extremely necessary. Shortness of breath can be due to many situations, such as extreme physical activity. But if you cannot catch your breath for an extended period of time, or if it is accompanied by chest pain, a fever, circulation issues, wheezing, or gasping, you should see a doctor right away. This inability to catch your breath could be a sign of a blood clot or pulmonary disease, both of which are extremely serious." Dr. Shilpi Agarwal writes, Without urgent evaluation, breathing can quickly become labored, and it can be catastrophic if not evaluated and treated quickly. Shortness of breath could be a sign of severe anxiety or even asthma. It is better to seek medical attention right away to be sure. Swollen legs mean that fluid is accumulating. Normally it should not happen, and it may be a sign of heart failure, thyroid problems, or even vein problems. If it is accompanied by pain in the calf muscle, it could be an indication of a blood clot. In any case, you should seek medical attention. Dr. Jacob T. Teitelbaum writes, if you flex your toes upward and it hurts, that's also suggestive of a blood clot. But do not rely on that. If it is hot, red, and swollen on one side, go to the emergency department. Regardless of what is causing the swelling, it is very important to have a doctor check things out right away. Serious and sudden pain in your stomach is definitely an indication to see a doctor. This severe pain could be a sign of an aortic aneurysm or other blood flow issues. If it is accompanied by nausea and vomiting, it could be a sign of painful gallstones. Dr. Richard Dicey writes, if the aneurysm ruptures, the pain tends to be sudden and severe and typically centralized around the belly button. Not to get panic with this symptom, but should take it seriously and see a doctor right away. Everybody feels tired some of the time and should not cause alarm. But if you are experiencing long-term fatigue and exhaustion, it could be a sign of something more serious. Possibilities are uterine or gastrointestinal cancer, hypothyroidism, anemia, or even depression. In any case, it is important to see a doctor. When the thyroid is underactive, the body metabolism becomes too slow. You may feel sluggish and put on weight. If you cannot kick that fatigue even after a good sleep, it is better to see a doctor. Pain in the pelvis, whether sharp, dull, or sudden, should be checked out by a doctor right away. Pelvic pain could be a sign of appendicitis, a kidney infection, a nerve condition, or even a hernia. In the case of an injury, pelvic pain could mean a possible broken pelvis. Dr. Julian Sink writes, even if it's just vague pain, it's not supposed to hurt down there. The list of possible causes for the pelvic pain is quite long, so it is probably better to be safe than sorry in this case. Everybody uses the bathroom, but if you find yourself having to go over and over again, it might be a sign that something is not right and that you should see your doctor. Excessive urination can be an indication that a mass is pressing on the bladder. These are often benign, but they should be tested right away. Dr. Julian Sink writes, if you are going to the bathroom more often, then a light bulb should go off in your head that something's not right. While this is not necessarily a reason to run to the doctor in the middle of the night, it is serious enough that it is worth getting checked out sooner rather than later. You know your body best. When you see or feel something different or just feel off, pay attention. Do not dismiss it. Thank you.